Welcome back to the World Economic Forum here in Davos, Switzerland. You're watching HuffPost Live. We're here in our broadcast center, and I am thrilled to be joined by Steve Davis, CEO of Path. Now, Steve, so much to discuss, and for those who don't know, Path is an NGO, obviously, that transforms global health through innovation. But in your words, what is Path?
Yeah, well, Path is a pretty unique organization in that we are very much about addressing the inequities that exist in the world around health and how poverty relates to health and health relates to poverty. But we really are about taking new innovations, particularly vaccines and drugs, tools and devices and diagnostics and even social science interventions, and figuring out how to develop them, adapt them, and get them into the hands of the people that need them the most around the world.
You know, I don't want to oversimplify it because that's always a problem when talking about health or healthcare, I should say, but it's very prominent on the agenda this year here in Davos. You know, we're obviously focusing on a lot of different issues: climate change, youth unemployment, income inequality. But when it comes to health, 25 sessions tackling some of the biggest issues here in the 21st century. In your estimation, what is the biggest challenge facing us when it comes to healthcare?
Well, I think there are two things. One is I think we are seeing, and the trends here in the World Economic Forum are demonstrating that there is a sense of and real growing inequity in the world and growing disparity. And that is actually, at the end, a big problem for the world, and health is both a driver of that problem, and it can be a positive result if we address that problem correctly. So I think in many ways that's one of the big problems. The other thing I worry about and talk a lot with people here about is how do we get more of the solutions we know work and the innovations we have today to scale into the hands of people that need them the most.
You know, your work spans a series of different platforms. I have 5 of them. I don't know if that's all of them. I would imagine there may very well be more, but vaccines, diagnostics, drugs, devices, and system and service innovations. For those who aren't necessarily familiar with that, I mean, when we try and apply those and we think of the role of the private sector, after all, Davos is all about trying to bring as many different people on board to tackle some of these problems. What is the role of the private sector? Emerging markets, for example?
Yeah, well, first of all, when we're looking at creating tools and mechanisms to address health issues in low-resource settings, we cannot do this alone. We have to partner closely with the private sector and with government. So let me give you an example of how we do that. In the world of vaccines, where we have a very large platform, both developing new vaccines for diseases of the poor, actually implementing and designing the uptake of existing vaccines in poor resource settings, and also tools and devices, how to give people vaccines in easier ways and manage the supply chain. We actually work with private sector in every step of that work. Because we're actually there to pull the sort of, for instance, a Japanese encephalitis, a very bad disease in Asia. Lots of kids get killed and maimed, but there's very little cost-effective vaccine for that, except one we identified in China. So we found the right company in China, worked with the right regulatory authorities, and now recently I just came from Beijing where we announced it had been released by the World Health Organization and qualified for use. So that's the kind of place where we have to collaborate with multinational emerging market businesses and governments.
You know, there was a tweet that you had posted that I caught my eye. It was on January 17th, I think. Sometimes the simplest innovations can make the biggest impact. And then you're talking about a tool that helps rice planters in Thailand. You know, sometimes when we talk about development, healthcare, we overcomplicate things. And, you know, there's too many things that we include. And how can this illustrate why the simplest innovations can make the biggest difference? I thought that rice planters in Thailand, I mean, who would have thought?
Well, let me give you actually a great, another story that shows how simplicity really can change our world. So about 10 years ago, we had this guy, this kind of like a popular mechanics, you know, kind of thinking guy that was in buying chicken in a grocery store and noticed that there was something on the packaging of the chicken that showed that if it had been thawed out or not, to demonstrate that, you know, don't buy that. And he thought, wait a minute, that's relevant to our world, because at the same time, we were thinking about how many kids in the world, first of all, don't get immunized for horrible diseases, or if they do, because the vaccine had broken the cold chain, it's not effective. So we're actually tragically immunizing kids, and yet it's not even effective. So he thought about that problem, thought about that chicken label, went back, found the company. We worked with them. We adapted that simple, what now is a little blue dot.
Right.
And if it changes color, it means the cold chain is broken. And now 4.5 billion units of vaccines that go out from UNICEF to the world have that on there. So it's like a very simple idea, was adapted and has saved millions and millions of lives.
You know, that's fascinating, and it's obviously an example of how a small thing can have huge impact. I know that your work previously was very much in supporting international refugees in the United States, Africa, Asia, and later China. When we talk about refugees today, obviously there's a refugee crisis unfolding and has been for some time in Syria. 1 million in Lebanon, that's almost like a quarter of the population now. Jordan, 10% of the population is refugees. And, when we're far removed, it's easy to kind of forgive or forget those facts and the true effect that they have, not just on those countries, those host countries, but the region and then the world at large, as we're all living in this globalized world. And it's kind of a passion of mine, because I'm from that part of the world. And I want to ask you, we think of refugees as not having access to water, as escaping a war zone, families torn apart. But healthcare is one of the biggest threats, both inside of Syria for those who are displaced and those who are living in Zaatari, for example. What can you tell us about why that's such a hard thing to manage for all these organizations, which are really exhausted at this point? I mean, if you look at South Sudan, Central African Republic, it's troubling. But what's so bad about it?
Well, I think you've got two things. One is you've already got in most of these situations, and even in sort of countries refugees flee from, often very weak health systems to begin with.
Right.
So, and usually by the time a humanitarian crisis gets to the point that you're having that scale of refugee problem, you're compounding it on top of existing health problems, weak health systems, and also fatigued, poor health people. And then you get sort of the combination of a lot of people in places where we don't have adequate water and latrines, and it just compounds the problem, and we simply don't have enough capacity to deal with it. We think we're not a humanitarian agency at PATH in the sense that we don't go into direct line conflict. I've done that before in prior jobs. But what's important is that we have to think about sort of systemic change at the same time we're doing immediate challenges. So we look at a place like Haiti or Syria and say, how do we help make sure that there's a low-cost cholera vaccine available? So when that is ready, it's ready to go, to be used and implemented quickly.
So, we're talking about vaccinations, and, there's a lot of lessons that can be learned, I think. And again, I'm speaking from somewhat of a position of ignorance, but in the U.S. and the West, from countries in the East, other countries, for example, India, able to empty its polio wards through, as I understand it, aggressive immunization. I mean, what are the lessons learned for the broader world?
Well, we've made a huge stride in addressing maternal and child mortality over the last 15 years, and there's lots of extraordinary progress, but we have a lot of work to do. And in looking at the progress, a lot has come out, arisen from both improved general economic and health conditions and vaccines. And so a few things that we've learned from that experience for the last 15 years that we need to apply more. One is we need to really address this cold chain problem over and over and over, and it continues.
Forgive me, what problem?
The cold chain, the thing I mentioned, that if you don't keep vaccines cold, they're not effective. And this is sort of, sounds kind of technical and geeky, but it's a really big problem.
Fundamental to
because when you're trying to immunize kids in villages in remote areas, and we can't, get it there cold. So we have to come up with a lot of creative solutions, and we're working on those. For instance, how do you use, refrigerator backpacks that are solar powered, and lots of things simple but effective to help challenge that problem. And so supply chain and cold chain are really obsessions that we are trying to address in the world. The second is, how do we manage to get people to change behavior in order to, or support their interest in getting vaccinated.
Yeah.
So a lot of people, you know, in the basic vaccines, that's not a problem. But as we get new vaccines, for instance, an HPV vaccine for cervical cancer,
Right.
which is given to girls,
Yeah.
it takes a lot of work to actually educate families and communities on what this means and how it's used and what it implies.
right.
And that's a challenge we have around the world. And the final thing I think we have to do is we have to just invest more in both the research and development of new vaccines and drugs and other tools, but also really looking at, you know, we like to say vaccines aren't given themselves.
Right.
Someone has to manage them. And
Right.
so about one out of every 5 kids in the world isn't fully vaccinated, and we need to close that gap.
You know, there's so much that we can discuss here at Davos and that they are discussing that pertains to healthcare, but one thing that's really front and center, and I think it's great that it is, and I'd love your thoughts on it, it's a bit off topic perhaps, but is mental health. And I would imagine that that factors into a lot of the programs you do, and you know, if we're talking about making the world a healthier place, and obviously the ethos behind Davos is to try and identify problems before they become a crisis, so that, you know, before we have to manage them, because we are managing so very many, you know, like we manage illness, we need to focus on preventative care, I understand that, and mental health. What do you think is preventing organizations, NGOs, governments, even businesses that are involved in this from making this a priority? I mean, mental health, at least for me, I read a book once by Dr. John Sarno called The Mind-Body Connection that changed my life. Because it made me realize, even though my friends would call me a hypochondriac, that I actually had psychosomatic issues that I needed to work with. And I would imagine that in conditions of extreme stress, like refugees, like certain developing parts of the world, I mean, why is that not as big a priority?
Well, first I think it's changing. There is a conscious conversation about the mental health, related mental health issues at the WHO, at the UN General Assembly last year. So we're actually seeing positive movement. I do think, as it's true in rich world, you know, that we don't look to mental health as being the first problem to solve. We often see it as, you know, as a secondary or third, a tertiary problem. I don't think it's right.
Yeah, I was going to say,
I don't think that's right, but I think it's the way we typically sort of look at sort of triaging a problem. And when you're I was recently in the DRC, where there's a lot of conflict, a lot of stress, a lot of very really challenging health issues. And our immediate issue is, you know, starvation, stunting, malaria and diarrhea, pneumonia diseases. Those are the biggest killers. And so you're not thinking immediately about how do I do that sort of systemic change for mental health. I also think the challenge is mental health isn't, you can't give it an injection. You can't give it a drug.
Which culturally, I think that's what we're so accustomed to.
And I think, you know, we are very accustomed in the global health community to think of interventions like that rather than this is about a more sustainable process.
You know, it's funny, you know, you go to the doctor and you have a problem. Let's say it's a real, you know, problem causing you a lot of pain, it's interrupting your life, and this is somewhat anecdotal, but bear with me for a second. And, you know, they tell you, okay, go do some yoga, don't use your phone as much, breathe deeply 10 times, and you'll see some great, you know, results. You go to another doctor and he tells you, oh, you know, you're stressed, you have this pain, take this pill, you'll feel fine. I would argue most people are going to want to take the pill because
it's fast and simple and easy.
Right, and I would imagine that needs to change a little bit.
Yeah,
I mean,
I think it will. I think one thing we're seeing is more openness, I mean, to non-traditional, quote-unquote, ways of addressing problems. I was just in Beijing a couple days ago where we were working on new interventions and partnerships, and it's come up quite seriously is how do we think about even Chinese traditional medicine, which is used widely across in some interventions. So I think there's openness, but it's not as empirical, it's not as direct, and it's not as fast.
Okay, last question. I'm going to ask you one of those questions you're never supposed to ask because it's a good or bad question, and it's obviously a little too simplistic, but here at Davos, globalization impacts everything, every conversation, every discipline that people are discussing. And do you think globalization is good for public health, or is it causing more challenges?
First of all, it's inevitable. It's there. We are in a connected world and getting more connected and even hyper-connected. And so I think it's somewhat rhetorical. But that said, I think it's generally good. For the reasons, I mean, I'm a deep believer and have a long history of how do you take innovation of
Yeah.
any sort, but primarily technological and media innovation, and then really use it to address a new social problem. That opportunity is extraordinary in the next decade. We have so much more innovation ahead of us, so much more impact, and it's in part enabled because we actually are in this hyper-connected world where we can trade technologies, we can find innovation. It's no longer the global north sends to the global south. We are tapping into innovators around the world. We're tapping into solutions around the world. And we are actually even looking at how do we repackage solutions that are working in low resource settings in India and bringing them back to Western Europe and the United States. So that's the best part of globalization.
So in the spirit of the mind-body connection, if you will, I've understood somewhat now how you would define success on a global scale in terms of your company, in terms of path and the work that it does. But as an individual, as a human, how do you define success for yourself?
Now, I've been extraordinarily lucky. I've had a very interesting career ranging from Chinese law to human rights and refugee work to starting an internet company to building and helping expand global health organizations.
But is the metric all
No, it's not. I have a great family. I've been a gay activist. I have a great teenage son. There's just tons of great stuff in my life. But my biggest measurement for when I make choices about how I spend my time is, can I have an impact? Am I having fun? And am I doing the right thing? And some days, you know, that's a tough set of decisions to make. But you know, it's great to be here at Davos because you can actually, you're surrounded by this sort of group of overachievers, right? But you can also step back and say, there's a lot of human connection, and you can make choices in this life if you're lucky. A lot of people can't, but we're of a group of people that can, and so if you can make good, solid choices about those kinds of healthy decisions, I think it's good.
Fantastic. A positive note to end on, perhaps. Steve, thanks so much.
Yeah, my pleasure.